Over 50 years of research show that cognitive behavioral therapy is effective for many conditions, but is it right for you? So I want to address this question based on two different things today. One is your personality and what you're looking for, and does that fit with CBT? And the other is which conditions CBT helps with the most. So let's talk about you. If you're looking for practical skills, if you want something concrete that you can work on in between sessions, that's also a plus for CBT. If you're really looking to kind of talk to somebody, go over a lot of stuff, really process through emotions, CBT may not be the best choice, or you might want somebody who combines CBT with a bit more of an attachment type therapy. And as I talk about this, I'll also explain to you kind of what CBT is, but I really want to get directly to answering your questions here as well. The third personality trait that would fit with cognitive behavioral therapy is if you're really looking for short-term therapy. Cognitive behavioral therapy, sometimes it's only 8 weeks, which is very short. But in general, I would say that with CBT, you should see major improvements within 6 months, or a totally different technique is needed. The fourth kind of personality or desire trait that goes with CBT is if you don't want to spend a lot of time in the past, because CBT is sort of very practical. What can you do today about it? But I do want to say that this is also a reason that CBT sometimes doesn't go deep enough. And I'm going to talk about that at the end of the video today. I also just want to come back to that first point I made, that you're willing to try new things, change some behaviors, try to think about things in a different way. Most people will have resistance to this. Most people will be like, yeah, that's not going to help me. But if you can apply curiosity and you can try it anyway, then CBT might be helpful. So CBT is really based on a very common sense view of how our thoughts, feelings, and emotions all tie together. And in many ways, the connection between these things really isn't debatable. Like, it's really there. And I do feel that some basic understanding of CBT is really helpful for everybody. Whether you struggle with a serious problem or not, I do think really understanding the CBT cycle can be helpful. So let me explain briefly what it is, and you'll, I think, see why it's so helpful. But basically, when we have a thought, that thought immediately impacts our body in a positive or negative. We immediately generate some kind of chemicals. Those chemicals create feelings, right? So, and our feelings have both physical components to them as well as emotional. And our thoughts will then also impact our behaviors. But it isn't all about the thoughts. And if you watch a lot of social media, all you'll see, your thoughts determine everything. Well, not really. I actually think your behavior is more important. But this is really a chicken and egg problem. All three components are important. So your feelings also impact how you think and how you behave, and your behaviors influence your thoughts and your feelings. So they all go together, and understanding how that cycle works for you is super helpful. CBT looks at 3 different kinds of thought patterns. One is automatic thoughts, those thoughts that just pop into your head automatically. 2 is cognitive distortions, the things that we do in our minds that really are false, like we believe them, but they're false. So that would be the catastrophizing, that would be the black and white thinking. They're distorted thoughts. And 3 is the underlying beliefs and schemas that you have about yourself and the world. So cognitive behavioral therapy will look at all of those different kind of thoughts, and then it will look carefully at how those integrate with your behaviors and your feelings, physical. And behavior includes both not avoiding the things you avoid. Most people who are struggling with anxiety or depression or different issues will avoid certain things because of those feelings. So part of CBT, unfortunately, is not avoiding. And not avoiding can also be seen as an exposure element of pushing yourself to face those things that are difficult for you. So as I mentioned, CBT is meant to be a short-term therapy. In fact, I was once asked to help a teenager who was sort of related to me, so definitely not somebody I could help. But I called a couple of therapists to see if I could find somebody. And we were looking for a CBT approach. And I called this one therapist, and he told me he worked with people for 8 weeks. And I said, well, what if 8 weeks doesn't do it? Nope, I work with people for 8 weeks, only 8 weeks. Like, it doesn't matter where the person is at the end of the 8 weeks. Nope, only 8 weeks. So there can be an element with certain CBT therapists where they're very, very, very structured and rigid. And I think a little bit more flexibility is useful. But overall, as I said, within 6 months, if you've been practicing, you've been doing exercises, you've really been trying, you should see major improvement for a number of issues. And I'm going to tell you what those are in just a second. When I release a CBT video, I almost always get a handful of angry comments from people who feel that CBT is total bunk and has dismissed their issues and their problems. So I just want to make it clear that if you ever feel that a therapist is dismissing you, not a good therapist. CBT never says you don't have real problems. CBT is like, okay, given these problems, what can you do about them? What are the best ways to think about them? What are the best behaviors to engage in? And how can we shift how you're feeling and thinking about it and behaving to get the optimal result? But in no way does it say all these problems are your fault. That's not what CBT should be saying to you. CBT is now woven into almost all therapy techniques to some extent. I do a lot of videos on EMDR, which I'll talk about a little bit later, but CBT is a component of EMDR. CBT is a component of mindfulness-based cognitive therapy. It's a component of almost all therapies because it is key. It's super important, but it isn't always enough. I'd also suggest when you go to a therapist, if the therapist says they're a CBT therapist, I'd kind of want to know what the training is, because there's a lot of therapists who might say, I do CBT, but they're not assigning any homework. They're not giving you exercises. That wouldn't be CBT. That would be more of a relational-based therapy. So that research shows that CBT is effective for a wide variety of mental health issues and kind of life struggles. But the strongest results of the research are for anxiety disorders, somatoform disorders, bulimia, anger control, and stress. So those issues have the best research behind them for CBT. But today I'm going to talk briefly about the issue of anxiety. I'm going to include a little bit on OCD, depression, and PTSD. So in my experience, I was a psychotherapist for 20 years before I started this YouTube channel. And I will tell you, for most anxiety disorders, psychotherapy in general can really help without any medication. So I found therapy, and I'm going to use that term broadly and then come back to CBT, but I found that therapy could almost completely resolve panic attacks, phobias, generalized anxiety disorder. And again, there, within 6 months with an anxiety specialist, I think you should see major improvement. Now, OCD, as well as social anxiety and also some health anxiety, is a little bit trickier. And those three things all have in common some very specific, focused patterns of thought that lead to certain behaviors. And the behaviors they lead to might give a temporary relief of anxiety. I'll give you an example in a sec. But those behaviors maintain the cycle. So health anxiety, thought comes in, somebody starts worrying about something, they run to the computer, they Google, they go through all sorts of stuff. Maybe they have a very momentary lowering of their anxiety because they're like, okay, this is nothing, okay. But then they leave and they're like, oh no, but what if it is that 2%? So the Googling, the behavior that comes out of the anxiety that gives that temporary relief is actually sustaining the cycle. Same thing with OCD, and actually the same thing with social anxiety, because people with social anxiety will avoid speaking up, they will avoid going out. So with all three of those, it has been shown that some type of SSRI medication can be super helpful. And there also would need to be a strong exposure component. So for OCD, exposure and relapse prevention therapy, very specific to OCD, although I actually do think it can also be helpful with the health anxiety. But it is a derivative of CBT, but it has a big focus on not engaging in those behaviors that temporarily lower your anxiety. So it's a hard road. I mean, it's being willing to tolerate some increase temporarily in your anxiety in order to resolve it over the long term. And I will be coming out with a few more videos on CBT and anxiety that's going to help you understand really how CBT helps anxiety in particular. But for today, I want to move on to the concept of depression. So CBT has been shown to be very effective for depression, yet the most effective has been shown to be CBT in combination with an antidepressant. Usually right now, it would be an SSRI. So an antidepressant on the one hand versus CBT alone, those seem to do kind of about the same, but combined is really where the best impact is. Now, the issue with depression, if you go to a CBT therapist, will you be able to do the behavioral activation, is what it's called, to initiate behaviors and activities that you don't feel like doing? So that can be hard for everybody, but for people with depression, it can be really, really hard. So when I used to have people come to me and they wanted to work on their depression, I would give it a try without medication, no problem. But if the person really could not motivate themselves or find any oomph to get moving and to try some different behaviors and different modes, even if it was like getting up and taking a shower, it's hard for some people. So if people really couldn't do anything, it was almost like there was a need for medication to power that. So that's just something to keep in mind. If you have depression and you're interested in doing CBT, what support will you need to help you actually begin to engage in the exercises? And if you can set it up or you have support, someone to help, then great. Give it a try. Now, CBT is also mentioned for trauma, and I do believe that trauma-informed CBT can be super helpful, but not all therapists are trauma-informed, which is very unfortunate because I think most people have trauma, which is at the root of a lot of these issues, right? So trauma-informed CBT would understand that there might be some traumatic memories stored in a way that is impeding you making progress, because traumatic memories get lodged in that old brain, in the emotional mammalian brain. And our frontal lobes don't always have access to that, but getting ourselves to engage in a new behavior, if our mammalian brain is like, no way, very, very hard. So a therapist who understands that trauma from decades ago might be impeding this can be super helpful, particularly when we talk about those underlying beliefs and schemas. Most of those are formed through some type of, could be a little T trauma, doesn't have to be a big major T trauma, but some kind of ongoing dysfunction that we grew up with that form those beliefs and schemas that are holding us back. So when we really can't shift them with sort of simple CBT, we need to go a little bit deeper. So I do have a PDF that goes into transforming your negative core beliefs that kind of incorporates a little bit of the deeper work, and that PDF is free. And then I also have a free webinar on rewiring your brain for joy and confidence that really goes into this concept of rewiring what's happening in there, which is one of the goals of CBT, right? We want to rewire that. But anyway, both of those resources are free. The links are in my description. Let me know what you think. Did you have other questions? Did you find this useful? And I'll see you next week.